The metabolic problem is at the root of the most expensive set of diseases in the world. I am working on ways to use of breath tests and other markers are to monitor diet, lifestyle and therapy. There are other potential uses such as new ways to monitor levels of acetone in acute and non-acute care setting, evaluate response to medical treatment, exercise, lifestyle and medications, test for inflammation, test for oxidative stress and new ways to evaluate what are the individualized health options for each person. Screening for with acetone and other markers should occur in clinics, hospitals, and ambulances, intensive care units and as a test for cell starvation for those on a ketogenic diet for cancer or weight loss, endurance training, etc. Test breath panel of the future may include volatile organic compounds for cancer and metabolic problems such as tests for acetone, isoprene and also methyl nitrate. There are other potential clinical studies that could be done for screening with acetone and the screening for metabolic problems such as prediabetes and diabetes and metabolic syndrome. There is an interesting study done in acute care settings of just doing acetone breath tests. I have picked up a lot of cases of DKA by smelling ketones on patients, a distinctive smell. It may prove difficult to tell blood glucose levels from acetone levels, so I am working on other possible benefits, uses. One way is screening for metabolic dysfunction in those without known diabetes, monitor treatment in those with diabetes, and monitor metabolism in those with diabetes or those whose diabetes is going out of control. Often I look for other medical problems in diabetics whose sugar goes up for no good reason. That is how I often find hidden infections and other medical problems in those with diabetes. Screening for metabolic problems for prediabetes and diabetes with breath tests of acetone, isoprene and also methyl nitrate was demonstrated in a study in Breathalyzer, 2011. Can volatile compounds in exhaled breath be used to monitor control in diabetes mellitus? This study by Smith et al. Looks at breath tests. This may also help with the evaluation of cancer. There are volatile organic compounds in exhaled breath are altered in disease, and it has been in the last few decades that it has been possible to measure them with sufficient accuracy and precision to make them clinically useful. The clinical utility of breath analysis has also been limited by the practical difficulties of collections and expensive equipment. More recent methods of breath analysis have allowed real-time analysis of breath, eliminating the need for sample collection, and therefore potentially allowing the rapid feedback of results to patient and clinician. One future application of breath analysis may be the monitoring of metabolic control in patients with diabetes mellitus with new kinds of tests that I and other researchers are working on. This article by Smith et al. Provides an overview of the studies of breath analysis in diabetes, focusing on the breath metabolites, acetone, isoprene and also methyl nitrate that have previously been reported to be altered in diabetes, highlighting the factors that may potentially confound their interpretation. Although a non-invasive method of monitoring glycemic control is clearly needed, it is important to demonstrate its analytical comparability with the well-established and validated methods for blood glucose measurement. A study in November 2013 describes use of a breathalyzer technology that detects acetone levels to monitor blood glucose in diabetics. A novel, handheld, non-invasive monitoring device that uses multi-layer nanotechnology to detect acetone has been shown to correlate with blood glucose levels in the breath of diabetics. This research is being presented at the 2013 American Association of Pharmaceutical Scientists annual meeting and exposition, the world's largest pharmaceutical sciences meeting, in San Antonio. Diabetes, which affects an estimated 347 million people worldwide according to the World Health Organization, is an autoimmune disease that prevents the natural cellular uptake of sugar from the blood and often requires continuous blood glucose monitoring. Current technology, such as the blood glucose meter, is invasive and causes discomfort to patients, often resulting in low compliance. This in turn can ultimately lead to poor health outcomes. Ronnie Prefer PhD, of Western New England University, created the multi-layer technology using nanometer-thick films consisting of two polymers that react with acetone. This cross-links the polymers and alters the physicochemical nature of the film, which provides a quantification of the acetone and thus the blood glucose levels. Other common shortfalls with current attempted breathalyzer technology are inconstant results due to the natural humidity of one's breath, high temperature requirements, and lack of selectivity. Prefer and others have clinics lined up to perform control testing with patients starting next year. Research from the University of Pittsburgh, led by Professor Alexander Starr, is going to study a diabetes breathalyzer that could be used in place of blood testing. The research, published in the May 21, 2013 edition of Journal of the American Chemical Society, used specially created carbon nanotubes to detect and quantify breath acetone and give an indication of blood glucose level. Research with carbon nanotubes in the past has needed higher concentration of acetone in order to detect it on the breath. However, new devices are being tested to find parts per million and even parts per billion of volatile organic compounds to be used as biomarkers like acetone. The research hinges on established uses and understanding of breath and disease. Acetone odor on the breath and its correspondence with blood glucose is among the most well-known associations. There has been some difficulty of determining the concentration of acetone in breath quickly, precisely, and at low cost, and new technologies can help. The carbon nanotube technology is particularly good for these kinds of tests. iPhones or home kits may soon replace invasive blood testing, and allow for more frequent and less expensive ways to do continuous monitoring. I hope to be starting clinic trials for this as soon as funding is available to do so.